All right, so let's start with a brief picture of how the long-term care sector was impacted during the pandemic.
Well, I think it's understood by most in the Canadian public that long-term care homes and our residents were disproportionately affected by COVID in a very tragic way. Really, COVID served as almost a catalyst to many of the long-standing systemic challenges that we've had across the country related to chronic underfunding, issues with short staffing, supply, and certainly aged infrastructure played a role in that as well.
All right, and what do we know so far about Ontario's newly proposed long-term care legislation, ma'am?
Well, we know that it's looking to strengthen accountability and certainly create a greater focus on the resident and their quality of life and quality of care. But I think it's important to note that it's only gone through first reading. And there are still many steps ahead. So it certainly is reasonable to anticipate there could be further changes at this stage.
And we're hearing from critics saying that this legislation doesn't go far enough to address the issues and gaps in Ontario's long-term care sector. What are your thoughts on this?
Well, I think that we're very pleased to see that it's legislation that lays a foundation for the modernization of long-term care in that province and helps to support a stable long-term care environment that can give confidence to residents and their families, as well as to the general public, that long-term care is meeting the expectations that we all collectively have. It's important that all governments and territories do their own kind of needs assessment and sort of breakdown of what did occur during the pandemic to come up with the right solutions for the homes in those provinces. And it's very critically important that they work with the long-term care homes themselves and families and residents to come up with those correct solutions.
All right, ma'am. Now, a lot of criticism is around the aspect of fines in this legislation, of them not being issued retroactively. So what are the pros and cons of this move here?
Well, I mean, I think that it would be very difficult to have a law have force and effect for events that occurred before it existed. So from that very perspective, I think that that's a real challenge. But I think what we can say about the last 20 months is that, it's really been unprecedented. The impact that that the pandemic has had on long-term care, and the frontline staff and the leaders in long-term care really have done extraordinary work. So as we look forward to the future, we really need to be looking at an approach that brings those resources and stable funding that is sustainable to these homes, so that they are being supported in the proper way. And it's really important to also note that there's a tremendous amount of work that's also happening with the federal government with the development of national long-term care standards. So bringing all of these groups together, both levels of government and the long-term care sector itself, for sort of a Team Canada approach, really is foundational to how we can make changes.
All right, ma'am, just about a minute left here, but what other initiatives would you like to see in improving long-term care, not only in Ontario, but the rest of Canada?
Creating a national strategy for health human resources, to me, is an absolute necessity. Finding a way that we can address immigration policy that helps to prioritize those who come from a healthcare background and willing to work in long-term care in Canada. Domestic workforce development, working with colleges and universities, is also critically important, that we're creating our own opportunities with Canadians. And shoring up mental health support so that we're building resiliency and supporting the existing workforce that we have so that they stay engaged. Infrastructure, creating opportunities to access financing, and that dedicated, sustainable funding is absolutely necessary for the future.
We'll be right back.